So I am one of the colorectal surgeons at UT. Three of us physician-wide in our practice. Again, Dean is our new addition as a nurse practitioner to our practice. And so, you know, we deal a lot with colorectal cancer, and that's not always, a subject that people like to discuss. It's also not a subject people like to bring up when it comes to issues that they may be having. So a little bit of a delicate topic. And so if you look at all the lifestyle risk factors, which we can discuss a little bit more in depth, usually when you look at odds ratios and things like that, there's a slight increase in risk. But when it comes to family history, it's 2 to 3 to sometimes 4 times the risk of the general population when you have a first-degree relative that's diagnosed with colorectal cancer. And so that outweighs all of our lifestyle, environmental factors, at least that we know about. Right? So it used to be 50, and it is now 45. And so that's a change over the past 5 years to try to reflect that increase in diagnosis in our younger population. The other scary thing is it's not only increasing in our younger population, but the locally advanced and metastatic diagnoses are increasing in that younger population. And so we may see that number actually drop over the next few years to age 40 or even age 35. In my practice, people come in very frequently saying, I'm age 62, never had a colonoscopy, I have stage 4 colon cancer. Okay, 58, I don't want to do a colonoscopy. Next thing you know, 8 years got away from me, or now 13 years got away from me. I've got locally advanced rectal cancer, and now I need a permanent colostomy bag, if at best. So this is my little plug and plea. The beauty of colon cancer, the beauty of my job, I get to cure cancer. I can cure cancer with a surgery. And 90% of colon cancer is cured if you catch it early. And so the whole point of doing all this is to catch this stuff early. We can remove it and cure it until or before it becomes a point where it's spread or become metastatic, and we're dealing with a bunch of different stuff, chemotherapies and radiations and potentially lifestyle altering procedures. So it's just really important that you guys make sure that's on your list when you hit those numbers. And the other point is too, you don't ignore other things that may be going on. Okay? Just because you're not 45 and you start having some of these symptoms, you got to get them checked out. So what can we do, when we diagnose these things? But the beauty of what we can do, not only do we get to cure it, but every year, every 10 years, 5 years, it's less and less invasive. And so used to be, you had a diagnosis of colon cancer, you're getting the up and down zipper, plus or minus a bag. Okay, big time lifestyle altering, procedure. So we can do laparoscopic surgery now, we got robotic surgery now, we got natural orifice surgery, organ preservation. That combined with a lot of our chemotherapy and our radiotherapy that we can do, we are moving the needle, and stoma formation is less. Okay, colostomies are less. We can do things with smaller incisions, less recovery. Okay, less pain, you're home sooner, getting back to your life. And so there's a lot of really exciting things that we're continuing to be able to do from a surgical perspective when it comes to colorectal cancer. And we're learning more and more about the genetics of these cancers. You guys have probably heard about immunotherapy. It's treating a number of tumors. We have targeted based treatments or mutation targets that we can look at. So you take your cancer, you send it to this, specialized flow cytometer, and it looks through, it shows all the genes and what's wrong with this tumor specifically, and then we can find a drug to target it. And it's really showing a lot of promise. Now it's changing our guidelines almost every year with what's the best thing to do for each specific type of tumor, and how we can sometimes melt them away with no surgery at all. It's really kind of exciting. So not every tumor is the same. Biology ultimately is king, as we always say, but a lot of advancements, and at UT specifically, where we can really hope, minimize the amount that somebody's got to go through and improve survival. That's just what we're always obviously trying to do. So.